Hello, I'm Jackie Roth, publisher and executive editor of Maryland Physician Magazine, Your Practice, Your Life. Welcome to Physician Spotlight, part of our integrated strategy, which is focused on building a physician network, which has a commitment to quality care for patients and their families. In our first Physician Spotlight, we're speaking with Dr. Stacey Keene, a mammographer with advanced radiology and board president of Komen, Maryland. On October 23rd, Komen, Maryland is hosting their most important fundraiser of the year, Race for the Cure, in Hunt Valley. We feel this is a perfect opportunity to spotlight the hard work that Komen, Maryland and Dr. Keene are doing throughout the year to fight breast cancer in Maryland.
My name is Dr. Stacey Keene, and I work for Advanced Radiologist. I do breast imaging. I'm also the board president of Komen, Maryland. When you do screening mammograms and diagnostic mammograms, we're on the front line on the war against breast cancer because we're looking for it all day. And that's why we do screening mammograms, to find it early and detect it early. It's really a rewarding job. If somebody has a suspicious mammogram, I can speak with the patient and give my recommendation for biopsy. And often I will share my own personal experience that I've been through biopsy and been through cancer and come out on the other side. I feel like I can give patients the benefit of my experience and reassure them that a diagnosis of cancer is something that can be survived, and you can live a good long life after it if you're fortunate enough to catch it early. Unfortunately, this is what we're still working for, to find a cure in everybody. My whole life has been devoted to ending breast cancer, finding it early, treating it, finding it when it is readily treatable and a woman will have to have minimal surgery. And so my involvement in Komen is just an extension of that. Komen, Maryland is celebrating its 20th year coming up next year, and Komen National is celebrating 30 years. And from the beginning, it's been a full spectrum, providing direct patients, grants for direct patient services to support women through treatment, education, screening. But also from the very beginning, it's funded research. So it's covered the whole spectrum from grassroots involvement locally in the community to supporting research to find a cure. Much of the funding of the grants that Komen, Maryland provides comes from the Race for the Cure. That is a big source of our income. The atmosphere is just so intense with so many women who have survived and who are supported by the community. I mean, when I'm there as a survivor, I just want to thank everybody for all the support and the fact that I'm alive 11 years later. And then it's just inspiring to see people not only supporting knowledge about breast cancer, but just having lived through it. And you see people in just a sea of people when you see the race. You'll see 30,000 people just as a sea in front of you, and it is nothing like it. And you realize that, yeah, we're going to find the cure. When you have people banding together like this, it's inevitable. We're going to end this forever, end breast cancer forever. As physicians, part of our mission is to heal and to inform and to save lives, and certainly Komen is in one with that mission. I am blessed to have survived breast cancer. I want other people to have the benefits of survival, and I want to give them my experience as a physician and as a patient to help them through. And so I feel like my mission in life is to end breast cancer forever.